This past week, a mother allegedly left her day-old baby on the steps at Penn Station, a disturbing situation for many to hear about. But the city and state have several programs in place so babies can be left at safe locations if parents feel they don't want the children or can't handle raising them. Joining me now with more information on this is the Commissioner for the Administration for Children's Services, Jess Dannhauser. Jess, thank you for being here.
Thank you for having me, David.
First of all, let's start off right here. What should a mom, and I want to say even a dad, do?
Sure.
They have a baby,
Sure,
and they don't want this baby. What should they do?
In the first 30 days of an infant's life, a parent can leave that child, no questions asked, at a safe location, as long as they let somebody at that location know. It's called our safe haven law statewide. This is a firehouse, a precinct. It could be a place where there are professionals and they let someone know, I need help for my child, and I'm ready to relinquish them.
Okay, so they can go there, safe haven, and you mentioned it, hospital, firehouse, precinct, and go in there. And, you know, part of the law is, I believe, the babies can be, once again, up to a month old, right?
That's right.
But no questions asked, because I can imagine some moms feeling like if I walk into a precinct and say, I can't take care of my baby, here's the baby, that they would be questioned.
This protection is in place to make sure that that baby is safe. And so to make sure that no one feels any fear to say, in that first 30 days, I can make sure my baby is safe. And again, as you said, a hospital, a firehouse, a precinct. The key is that the family, the parent, makes sure that someone there knows that they're dropping their baby off.
Mm-hmm. And no criminal charges.
That's right. That's right.
It's state law. And actually, right, I understand some of the locations, I'm not sure if in the city, but in other states, there's actually a safe haven box where a child could be left in.
That's something that may be in place across the state, but what's key for New York City is let somebody know, right? If a firehouse is closed, we want to make sure, not here in New York City, it wouldn't be closed, but we just want to make sure there's a responsible adult that parent has let know so that the child can immediately get the medical treatment that they need.
And this is a complicated situation, and we have a few phone numbers we're going to pop up as we have this discussion so people can write them down. But it's a complicated situation. The recent case this past week, the mom going to Penn Station, leaving a baby in a crowded subway station. So some would say, well, that mom really didn't want to abandon the baby because she didn't throw the baby in the trash. But what do you say to families or moms? They may be struggling with mental health issues or just struggling, because it's one thing to turn your baby in, but there's another thing to say, well, maybe I want to keep my baby, but I'm confused.
Absolutely. You know, that early time in life is a really vulnerable time for that infant. It's also a really stressful time for parents, even in the most best circumstances. And so we know that we have to make sure we're looking out for moms. Postpartum depression, postpartum psychosis can happen. So our message is reach out. 212-676-7667. That's our support line. Again, 212-676-7667. Families can get help. This can be counseling services, can be diapers, it can be concrete needs that they have. We want to make sure families know that there are options for them to have their whole family be supported.
Yeah, and you know, this happens too often, really. As we were getting ready to talk about this, we found out on Sunday afternoon, a mom went into the water, perhaps with her baby. We're still getting the details. And we know a mom in Brooklyn once drowned herself and her 2 children. So this is something more families should be looking out for, right, when it comes to new moms or even an older woman who just had a baby.
That's right. We have to make sure we are reaching out to parents with a really compassionate understanding of how hard that early life is, and to make sure that we're protecting children in the meantime. The goal there is to make sure we get to it early, so families know they can reach out to us through that number, 212-676-7667. We've trained all of our staff, our child protective specialists, all of our nonprofit specialists to do work around postpartum depression and psychosis, just to understand that that is such a vulnerable time. It doesn't mean that you have to have your child removed, but it does mean we want to bring a community of support around you, and you can kick that off by giving us a call.
And, you know, there's also the need for people to adopt children and babies, maybe even teenagers, or foster care. Talk a little bit about that program if you can.
So when a child comes into care, we need to make sure they're going to a very loving foster parent. Nurses, doctors, lawyers, folks who are social workers in any field can come and be a foster parent. 212-676-WISH, that's 212-676-WISH. We want to make sure that every child who has to come into care, of course, the key is to prevent this whenever we can, but when a child needs to come into care, we want to make sure they're with the most loving home and the most capable home.
And very quickly, I want to mention the number for the New York State Safe Haven information. That's 1-888-510-BABY, and you say not only psychological help, physical help, and even if you need something like diapers, you guys can help out.
That's right. Reach out. We're here.
All right, Jess, thank you so much, the Commissioner for ACS, everyone.
Thank you, Dean.
Thanks for watching our YouTube channel. For more stories in your communities, click the subscribe button right here. You can also download our app or watch us on TV for the latest news and weather updates every 10 minutes and more. We'll see you then.